Hi there, do you suffer with back pain, lower back pain, numbness and tingling, sciatica, lost and or diminished of function due to the back pain? Well, you may unfortunately have a nerve or groups of nerves that are being stretched, compressed, and irritated, keeping you from what you need, love, and want to do. Hi there, I'm Dr. Kevin here at Bowie Chiropractic. Just want to spend a few minutes talking to you and showing you how you unfortunately may be suffering from a nerve or groups of nerves that may be stretched, compressed, or irritated. Well, first of all, we'll go ahead and look at the skeleton here. And inside the skeleton, you can see we have the spine. And you can see from a side view, the unique aspect of the spine are the curvatures. So let's point out the parts of the spine. Up above, we have the cervical, we have the thoracic in the middle, and we have the lumbar section of the spine. Now the spine is there not only for allowing us to absorb and dissipate energy, but also to allow us to have movement and for protection. Movement is designed with the joints that are in between the bones of the back that we call vertebrae. Let me show you a closer view of what I mean by a vertebrae and the joints. So here's a closer view of a section of the lower back. These again are called vertebrae. We have the vertebral body of these two bones. And then on the other side, you can see there is an actual facet joint. There's a superior articulating facet and an inferior articulating facet that again make up the facet joint that allow for mobility. On this side, you can see there's a disc. And on this side, you can see there's a joint. And of course, on the sides of what would be this hole that we call a foramen that this nerve exits. Over time, fatigue, wear and tear can put stress, of course, on these segments of the vertebrae, or I should say segments of the spine, causing joints to become what we call misaligned, possibly too far compressed, or we have pockets of inflammation all affecting these nerves, leading you to have those terrible symptoms that we discussed before. Now that we have spent a few moments in going over a section of the lower part of the spine called the lumbar spine, and seeing how the nerves exit these holes called foramen, and how they could possibly be stretched, compressed, or irritated, let's go into further detail of how you may be suffering from a nerve being stretched, compressed, and or irritated. Again, looking at the side view of the skeleton, and of course the spine, we can see that there are curvatures there. Those curvatures are so important in order to absorb and dissipate energy. You can see that it can work, or does work, like a spring. Here again, we have the cervical part, the thoracic part, and the lumbar part, all sections of the spine. The stressors that affect the spine, we'll keep it somewhat simple. From above, we have gravitational forces, and below we have reactive forces. Now I do understand there are direct traumas, emotional traumas, chemicals traumas, and other sorts of structural traumas that can affect the spine. But just to keep it simple, we'll look at gravitational stress and day-to-day reactive stress and how that affects the spine. So those forces come together within the spine and need to be absorbed and dissipated. And that is what the curvatures are there for. Now with the close-up, when I showed you that just a few moments ago, you could see on one side of the spine, on the front or anterior as we call it, there's a disc separating the vertebral bodies. And then on the posterior part, or on the back, we have what are called facet joints that allow for mobility. They give us three planes of motion. We get flexion extension, we have lateral bending, and we have side-to-side rotation from having those wonderful facet joints there. Now over time, wear and tear, let's say fatigue, that happens unfortunately to the spine, can cause vertebral misalignment, could cause joints to be too far compressed, or you could have pockets of inflammation, all three affecting a nerve. Chiropractic care is a conservative form of care where we focus on alignment, function, and ways to reduce and or eliminate stress or inflammation. Again, as a conservative form of care, so that your nerves do not suffer from being stretched, compressed, and or irritated, and getting you back to doing all the things that you love, need, wish, and desire to do. For more information, check out my website, bowiechiropractic.com. Thank you for tuning in. We'll talk soon.